Hi, my name is Dr. Reena Pandya, and I'm a senior lecturer of physiotherapy in the University of the West of England. In this unit, we are going to cover muscle functions and how to identify those muscles with ways of exercises or contractions. So the first muscle we're going to talk about is latissimus dorsi. The function of the latissimus, or we call it the lats colloquially, is to move the shoulder joint, and the movement that it's involved in is an extension of the shoulder, adduction, and internal rotation of the shoulder. Now, this is a large flat muscle which basically gives that V shape to the torso, and some exercise considerations where we can activate these muscles is when we do pull-ups or pull-downs. So that's when we use the latissimus dorsi, and it's a major stabilizer of the glenohumeral joint as well. Then we have the deltoid. Deltoid gives the rounded outlook to the shoulder. It facilitates with lifting the arm in three different directions. That's in the front, to the side, and to the back. That's anteriorly, laterally, and posteriorly. And it gives the contour of the shoulder. And basically, when you do a shoulder press or a lateral raise, that's when we use the deltoid muscle. Lateral deltoid for the lateral raise, and shoulder press, we use the anterior deltoid. The rotator cuffs, these are basically the massive stabilizers of the shoulder, and they also generate various movements around the shoulder joint. So the rotator cuff comprises of four muscles. That is the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. All of these, they basically arise from the scapula, they come forwards and come and insert into the greater tuberosity and the lesser tuberosity of the humerus, as we discussed earlier. Now, many exercises that we can talk about this, if you do lateral hand raise till 30 degrees, that'll be a supraspinatus. Then if we do rotation using therabands or dumbbells, that'll be your other two rotators, and then we have the subscapularis that does the internal rotation. So having said that, several of these movements, that major movements that we carry around the glenohumeral joint, they happen with the use of rotator cuffs. Then what we have is the pectorals, or we known as the pecs. There are two sets of pecs actually. We have pec major and pec minor. We're going to talk about pec major, where their primary function is to create flexion, adduction, and internal rotation of the shoulder. So if you're driving a car and you turn your steering wheel in, you'll be using your pec muscles. They're located on the chest. They're large, they're fan-shaped muscles, and basically you can contract these muscles while doing a bench press or push-ups. Biceps, the two-headed muscle, basically, as we said, it originates from the intertubercular sulcus in the humerus, and its job is two-phase job. One is to create a flexion of the elbow, and it rotates the radioulnar joint to create what we call as a supination movement, where your palm turns upwards. So the exercises that we can actually elicit the contraction of the biceps, for example, could be biceps curls. The triceps is responsible for extension of the elbow. It is a three-headed muscle that is located at the back of the arm. It basically counteracts the movement of the biceps, and the way to elicit the contraction of the triceps is by the dips or by triceps extension. Abdominals, these are your core muscles. These are your core stabilizers. They assist with posture, they assist with breathing, they assist with childbirth, they assist with the bathroom movements as well. They're located in front of the abdomen, and if we talk about rectus abdominis, that basically gives you that six packs, or we have the obliques on the side, which give you that little V-shaped, or the cuts on the side, that is your oblique muscles. Some of the common exercises that do that is your crunches or planks. They activate your core muscles. Hip flexors, as the name suggests, they flex the hip. The name of the hip flexor is iliopsoas. So if I am stepping forward, if I'm climbing up a step, or if I bring my knee to my chest, all of those movements, they're elicited using hip flexors. Now, these are located right here in the front, in the groin region. And as we said earlier, there's several movements that are made possible with the help of hip flexors. The gluteus maximus or the gluteal muscles, they are your buttock muscles, and they basically counteract the movement of the hip flexors. And what they do is, since they're located posteriorly, when you kick the leg back, you're basically activating your gluteus maximus muscle. Along with hip extension, we got two other gluteal muscles, that is medius and minimus. They also do abduction and external rotation. Squats, bridges, these are some good examples of eliciting glute work, or climbing the stairs backwards or walking backwards as well. Hamstrings are present at the back of the leg, of the thigh. They counteract the movement of the quadriceps that are present in the front. Essentially, since they're at the back of the leg, they create knee flexion, and they also facilitate gluteal muscle work, and they help with hip extension. Doing something like deadlifts or hamstring curls will contract the hamstring muscles. The quads or the quadriceps that are located in front of the thigh, since they're in front of the thigh, they help with the frontal movement, which is the kicking of the leg, or what we call as the knee extension. Four muscles form the quadriceps, and hence they're called the quadriceps, as in quad as in four. That's your rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. And basically doing activities such as squats or leg presses or lunges kind of activates these quads muscle. Gastrocnemius, also known as your calf muscles, basically help with toe pointing down, that is plantar flexion, and they also assist on the superior side and flexion of the knee. So when you do something like calf raises, for instance, they are the ones that are made possible with the contraction of the gastrocnemius. We also have the muscle called the soleus, which forms the part of the gastrosoleus complex. They are located between calf muscles and the heel, and they are pretty big actually, but they're covered with the calf muscle, so they're present under the calf muscle, and they also help with plantar flexion, which is pointing of the toes. Tibialis anterior, which you see the muscle in the front that's present right along the shin, their job is to create dorsiflexion, and they also invert the foot in. They're located in front of the lower leg, and basically if someone walks on their heels, perhaps, that's what elicits the contraction of tibialis anterior. So now let's talk about the overview of the joint structures and the role in injury prevention. So now, one of the saving graces, so if we know the joints are made up of two bones that are held, that basically move in relationship to each other, we want to make sure that these bones don't rub against each other. So think about grinding your teeth. If your bones would grind against each other, then that would create conditions such as arthritis. So in order to prevent this, what we have is something called a synovial membrane. It is a thin layer of connective tissue which lines the inner surface of the joint capsule. And this synovial membrane, it secretes this gooey fluid called the synovial fluid. And this is basically a lubricant to the joint, as a result of which it prevents friction that would occur at the joint. So this prevents injury by creating smoothness, by creating that little lubrication factor, and thus preventing degeneration and wear and tear and conditions such as arthritis. Now the synovial fluid that it produces, this fluid is like egg white. It's viscous in nature. It reduces friction, but it's also very rich in nutrition. And this nutrition is useful for the cartilage that is present in between the joint surfaces. So again, it helps with reducing friction and acts as a shock absorber so that the bones don't bump against each other. Now, as the name suggests itself, joint capsule. Capsule is something that is basically, that covers something. And this capsule is required for that synovial joint. And it is, outer layer is a fibrous layer, and inner layer is made up of the synovial membrane, as we spoke of earlier. So this is a protective in nature again. It makes sure that if I have my two bones sitting here, my capsule actually surrounds it, protecting the joint surfaces, so that again it's an added layer of protection against any sort of injuries A cartilage is rubbery, right? And it covers the ends of the joints and the synovial joints. And again, similar function: protection, provides smoothness, reduces friction, prevention of any kind of degenerative diseases like osteoarthritis, which also means that people who have osteoarthritis, that means that the cartilage is worn out or is in the process of wearing out. Ligaments, as we spoke of earlier, it connects bones to bones, making sure that it prevents dislocation of the bones.